Well, hello again. My name is John Giles. I'm an associate professor at Columbia University in New York City, and I'm reporting to you on November the 8th, which is the third day of research presentations at the ACR meeting. One of the big abstract groups this year, and one that's gotten a lot of interest, is the oral surveillance study. Specifically, abstracts that were presented yesterday and some additional abstracts on the same study are being presented tomorrow. The ones that were presented yesterday was abstract 831 and abstract 958. These were looking at the primary data analysis from the trial and also some subgroup analyses. This is, for those of you not familiar with this trial, this is a post-marketing safety surveillance trial mandated by the FDA, looking at 2 doses of tofacitinib, 5 milligrams twice a day, 10 milligrams twice a day, with the comparison arm being a TNF inhibitor, either adalimumab or etanercept, depending where in the world you were enrolled. And what they found was that the study did not meet its non-inferiority endpoint for either major adverse cardiovascular events or for malignancies. Now, that doesn't mean that the drug is inferior to the TNF inhibitor in terms of the safety outcomes. It just means that non-inferiority was not proven. So in the presentations from the meeting today allow us to drill down on the data quite a bit and interpret it for ourselves. Interestingly, the rates of cardiovascular events were actually quite low in all of the arms. And I think that's consistent with the notion that reducing inflammation, especially in the people who were involved in this trial, so the inclusions involved people who were older, they had to have at least one cardiovascular risk factor. So these patients in some ways were primed to have cardiovascular disease. We know from prior studies that people who take TNF inhibitors actually have a lower risk of cardiovascular events over time. That risk is about 30% lower across trials. And it's not uniform across trials, but it's fairly consistent over time. So we know that TNF inhibitors likely have a powerful protective effect on stabilizing unstable coronary plaques, for example. And I think that probably also extends to the JAK inhibitors as well. But these data suggest that there may be something physiologically that's slightly different about that level of protection, and that maybe the TNF inhibitors allow just an additional level of protection against those destabilization of the plaques that lead to events. In this particular trial, the number needed to harm or see a differential effect compared with the tofacitinib arms compared to the TNF arms was in the range of 400 to 500. So you'd have to treat 400 or 500 people with tofacitinib to see a difference in major adverse cardiovascular event compared with the TNF inhibitor. So again, when we've received a lot of questions from rheumatologists about how to counsel our patients, what we've learned is that it's the patients with the highest cardiovascular risk who seem to be susceptible to this differential effect. The risk is small. If our patients are doing well on a JAK inhibitor, in my opinion, we should keep them on the drug. It's just that when we're making the decision between an initial treatment between a TNF inhibitor or a JAK inhibitor, especially in patients who have cardiovascular risk factors, if we know they have coronary disease, if they have any kind of unstable cardiovascular disease, then I think this allows us to go down one direction rather than the other. And that when we're uncertain, I think that we should think about our patients' cardiovascular risk level, treat them appropriately. And then in patients who are appropriate for a JAK inhibitor, we should use these and feel very comfortable and safe. We're learning more about the other outcomes from this trial. DVT and VTE and PE are being presented tomorrow. The cancer risk and other malignancies are being presented tomorrow. as well. So more to learn from this very interesting study that's getting a lot of buzz at this meeting.